in RG3's injury. The anterior cruciate ligament right there in the middle runs through the center of the knee joint and is critical to stabilize front and back motion of the leg. How are they infecting people?
CRE can manifest itself in all sorts of ways. So it could be a pneumonia, it could be a urinary tract infection.
The condition is hypothermia. It happens when the body temp drops below 95 degrees. That is close to 4 degrees below normal. First of all, let's start with what you see when you look in the back of the eye. Here we can take a look at this. What's going on there?
What's wonderful about the eye is without actually cutting open the body, we can just dilate the eye non-invasively. We can look inside and see the blood flow to the retina. And here you can see some of the small little hemorrhages and evidence of leakage, which are those little yellow spots which indicate a cholesterol leaking out of the system.
Finally, the other things that they'll work on are increasing his range of motion for his knee flexion. So they'll use a strap or a towel or something like so, and they'll do something that we call a heel slide, where they'll basically be bending that knee back to work on improving that range of motion.
In tonight's Health Alert, one family's battle to save their husband and father from what the flu did to him.
He started choking, and all the people rushed into his room.
In tonight's Health Alert, operating on the delicate inner workings of a child's body and getting that child out of the hospital faster. That's what's possible with laparoscopic surgery and the high-tech guidance of a robot. Just ask one little girl from Virginia who wants to tell other kids, hey, it's cool. You don't need to be scared.
They got me checked in everything, and then I got my surgery done.
And she spent one night at Children's Hospital, and we were home the next day by 3 o'clock.
And Sydney was back to sports in a couple of weeks. Her kidney has worked perfectly ever since.
I guess in college we all knew people who did lots of things, and it was never something that appealed to me. Why would I do it at 56?
Judith is taking part in a federally funded study at Johns Hopkins in Baltimore using psilocybin, a compound from the mushrooms that exploded in popularity in the 60s and is still abused by some to get high. Changing the way little ones are bathed in the hospital could be a lifesaver. A study out tonight from Johns Hopkins looked at more than 4,000 children in intensive care units and found those who got daily antiseptic baths had a 36% lower risk of getting a dangerous bloodstream infection. The heart pumps weakly and erratically, and doctors don't really know the cause. She underwent 3 heart surgeries and now has a combo pacemaker defibrillator inside her chest.
So it's like a traveling, you know, the ones in the wall panels.
It's inside?
It's inside me.
And that device has corrected her heartbeat several times when it got dangerously out of whack.
I would not be alive today without my doctors and the surgeries and the ICD in my chest.
As the manufacturers tell you, cell phones should not be held up next to the body or brain.
What are some suggestions that you give people if they're saying, what could I get for Christmas? What could I get for Hanukkah?
Listen and get a feel for the needs of the patient. Understand their journey and understand how you can support.
David suffers from hereditary angioedema, or HAE, a relatively rare genetic disorder that's caused by the lack of a crucial protein in the body. This leads to uncontrollable swelling, particularly of the face and airways. You can imagine how dangerous. Experts are still trying to figure out exactly what triggers the condition.
Well, it was a pretty good twist.
Today, a therapy using Anna's own blood is helping her get rid of the pain from this old injury and avoid surgery.
We inject it right exactly into the spot that's injured.
Platelet-rich plasma therapy, or PRP. Dr. Mayo Friedless of Capital Spine and Pain Centers says it's an exciting, emerging treatment that uses the body's own blood platelets to heal tendon injuries and osteoarthritis. The group says it's safe to wait 5 years. But Tamika disagrees.
It's dangerous telling women to wait every 5 years because I think women will wait longer unless there's some sign of a problem.
Now to a life-changing brain surgery. It's done while the patient is awake. It's called deep brain stimulation, and it helps control the tremors and stiffness of movement disorders like Parkinson's disease. New research out today says it should be done earlier before symptoms progress to a severe state. Tonight, I follow a local wife and mom through the procedure and show you the difference it can make.
It kind of eats away at you little by little, you know?
We first met Sutapa Kasibatla in her Leesburg, Virginia home last fall. The mother of 2 was diagnosed with Parkinson's disease in 2004 at the exceptionally young age of 36, when her boys were only 2 and 5.
Right now, after almost 8 years of Parkinson's, I've reached a stage where medications are not helping much.
Sutapa has both uncontrolled tremors and rigidity in her limbs and found herself able to do less and less with her family. So on November 15, 2012, she underwent a deep brain stimulation procedure at the University of Maryland Medical Center in Baltimore, an institution that's been working with DBS for more than 10 years. While a metal frame keeps Sutapa's shaved head perfectly still, neurologists precisely guide a probe into the part of the brain that controls movement. They're implanting a stimulator that uses electrical current to jam abnormal brain signals.
Move your right leg.
Later, a pacemaker to control that stimulator is implanted in Sutapa's chest. And after several weeks, when the surgical incisions have been able to heal, we see her again on the day the stimulator will be turned on for the first time. In the waiting room, she's full of anxious hope for a more normal life.
To be able to run errands and, hug my kids without shaking, to be able to make the lunches,
We're going to turn the device on.
Neuropsychiatrist Dr. Karen Anderson shows Sutapa how to control the DBS settings with this remote and then turns it on. Watch Sutapa's foot instantly relax, even though she's had no medication at all. Her husband helps her try to stand and walk as the deep brain stimulation is readjusted. It's not easy, but progress is made in baby steps. And this is the couple at home just this week. Sutapa has enough control to enjoy cooking again. She's even stenciling a wall with flowers. It's why she underwent the grueling surgery in the first place.
Others have done it, have come out of it. They've seen positive results. There's no reason why I can't do it. All I have to do is to be strong.